Good morning. It's Friday, May 15th, and you are here with us at The Doctor is In, Ask Dr. Arwady. I am Sybil Madison, your Deputy Mayor for Education and Human Services, and I'm so pleased to be sitting here 6 feet away from Dr. Allison Arwady, your
Morning.
Commissioner for Chicago Department of Public Health. This is where you can get your latest updates on COVID-19 in Chicago and get your questions answered. You can put those questions in the chat box below. You can also send them to us through Facebook or Twitter using the hashtag AskDrArwady. We're going to check our distance and make sure we're good. And I'm going to turn it over to Dr. Arwady to just give us an update on the latest.
All right, thanks, Sybil. So, good morning, everyone. As always, you should go to chicago.gov/coronavirus. Right up at the top of the page is where you can find a link for the latest data and reports. I'll note that we put some more information up there about some of our work with people who are unstably housed in Chicago. We've been adding some additional reports pretty much every day in that section, as well as obviously continuing to add other resources to the website. So if it's been a little while since you've been on there, I encourage you to explore it. We are at 34,413 lab-confirmed cases of COVID-19 in Chicago residents, and we're at 1,552 deaths in Chicago residents. So we have now crossed that 1,500 death mark, unfortunately. That was an increase of 1,293 cases and 53 deaths since the prior day. And you might remember I mentioned yesterday, we'd had a couple of days that were a little bit lower because there were some technical issues with the way some of the commercial labs were reporting in. And so those now, it appears, have been resolved. And so we'll be putting these cases onto the appropriate dates when they were tested. And overall, you know, we really are, we're seeing a good flattening, and then particularly, we'll talk about our percent positivity just in 1 second, because that, of course, is one of the main measures that we're interested in. So first of all, in Illinois, we're at 87,937 cases, and then 3,928 deaths. So we'll probably pass the 4,000 death mark, I would guess, this afternoon in Illinois. So let's pull up the testing data. So I'll remind you that this is both the graph that lets you know how many people have been tested and the percent that are positive. And the reason we talk a lot about the percent that are positive is it's one of the easiest ways that we know how we're doing as a state and then as a city, but then also we look within the city to see where there are clinics or areas that have a high percent positivity. Those are the places where we work to drive additional testing. Those are the places where we make sure we're doing additional outbreak investigation, contact tracing, et cetera. And so the state, I'll remind you, has set as that reopening goal a 20% positivity overall. And so, you know, in our number one goal, if you look at what we did within Chicago, it's about seeing a decline in cases and or sort of correcting for the change in testing by using this percent positivity as needed. And so as of today, we've tested almost 125,000 people in Chicago. And I'll remind you, these are people who are tested. So if people get tested multiple times, they only get counted once. And we are now up to 3,336 people tested per day on our 7-day average, which is really increasing well. We're aiming toward 4,500 by the end of the month. And I'm feeling pretty good that we're gonna get there. So that's going the right way. And then you see our percent positivity is 21.4%. So that has been declining really nicely. And I think we're in the 11th or 12th day of seeing some decline there where we average it out. So we're planning a bigger sort of data metrics update, likely for early next week, where we'll really go through in detail where we are on all of these metrics so that you know what we're following along. But I continue to feel really overall confident with the way that we're moving. As you know, we set some goals that were strong and optimistic, and based on our data here, aiming toward really the end of the month, and hoping that we'll be able to get there. We do divide out that percent positivity. The 20% is overall, but ideally we'll be at a point where we hit that 30% in our congregate setting and 15%
community.
In the community, right? But so this is really nice, and that's that blue line on here, as you can see. The sort of lighter gray or yellow shows you the number of tests that are done in total. The black are the ones that are positive, and then that blue line shows you the percent that's positive. So you can see that's been sort of downtrending really nicely. I think other than that, I'll note that we really do continue to see a lot of our new cases in the Latinx community. So as you know, that's where the city's been driving additional testing. We opened at Saucedo down in Little Village 2 days ago, and then today actually is when the site is opening at Prieto. Yeah,
in Belmont Cragen.
And so we, at this point where we look at the race ethnicity of our cases, about 43% of the cases for those for whom we have race ethnicity are in the Latinx community, about 33% in the Black non-Latinx community, about 16% in the white non-Latinx community, about 3% Asian non-Latinx, and then 5% in people who report other non-Latinx. I think let's go ahead and pull up actually the case count maps. Reminder that we update these 3 times a week. So let's take a look first. This is our individual case counts by zip code. So this is just how many people have been diagnosed since the beginning in a zip code. If you go online, particularly the part under the data portal, you can play with it. You can look for, I want my zip code, I want last week, I want to see how the change has been. We're getting all kinds of new data up on that data portal so that people can do their own sort of data explorations. But this is the overall cumulative cases.
And the data portal is under that tab that says latest data.
Yes.
You can click on data
Exactly.
portal.
You can see the data reports, you can see the hospital data, or you can see the data portal. So overall, if we look at the map here, so as always, darker blue means more. And so in the lightest, the very kind of whitish, very lightest blue, you can see in those zip codes, we've had between 7 and 142 cases in those zip codes, whereas in the very darkest blue, we've had up to more than 2,100 in some of those zip codes. And so you can see that really in total now, that 60639 up on the northwest, the 60623, 60632, and 60629. So that, of course, is in line with some of the recent places that we've been looking to push testing, et cetera. So I just think it's always helpful for people to look at this and see whole city has cases, whole city continues to add cases, but even more so in those areas. And then let's look at the second map. This is, remember, the case rate, where we correct for population. And so in this case, you take the number of cases that were in a zip code and you sort of divide it per 100,000 people. And so it's a way to better compare. You would always expect a zip code that has more people in it to have more cases. And so this is a way to help recognize that. And so here, you can see that we're not seeing a whole lot of difference between where we're seeing a lot of cases and a high case rate. So still really in those same zip codes by and large. So a little bit of difference there, but really highlighting why with the Race Equity Rapid Response Team and just the general response, while we continue always to do work across the city, our goal is to really make sure that we're doing everything we can to get resources where they're needed. Obviously, things like language access, things like getting information out, is part of the ongoing plan and how we're using this data to really shape the response. Do you want to add anything?
No. No. I mean, this is why we have these testing sites opening up, and I'm so excited for that work. The thing that I did want to mention, which we don't talk about as much, is we're looking at the case counts.
Yes.
That a lot of those numbers also represent people who've recovered from COVID-19 as well, right?
Absolutely.
Because we're starting from the beginning of knowing when people
the
have
great
cases.
Majority of them have.
Yes.
Yeah. So.
Okay. Do you want me to go to questions?
Yes.
Okay. Sorry, doctor.
No worries.
Okay. Elizabeth Kotlarczyk from Facebook. Is there a site or resource to see current or updated hospital bed capacity and vent availability for the state and or counties?
All right.
So you just mentioned that we have it for Chicago.
We do.
On our website.
We do. So a couple things. So why don't we maybe just talk about that? We haven't talked about the Chicago hospital bed capacity for a little bit, so we'll do that. And then for the state, you can go to the Illinois Department of Public Health website, and they do have it available, I believe, by region there. dph.illinois.gov. But here in Chicago, because that of course is the data that we're the most focused on. Now what's different about our hospital data as opposed to the case data is that this is what gets reported in from all of our Chicago hospitals. And so there are many patients in Chicago hospitals who may not be Chicago residents, right? We have a lot of
people come in from the suburbs.
People come in, we have a lot of the big academic, especially hospital centers here. So there are people who can be residents of all over, but this gets a sense of how our hospitals are doing capacity-wise. And so if we look in total, we have we have exactly 474 people in Chicago hospitals who have COVID. Either they have been diagnosed with COVID, or for some of them, the doctors think they probably have COVID and we're waiting for a test result. So that's what we call a person under investigation. So there are 474 people in ICU beds with COVID. And just for comparison, there are 699 people in ICU beds who do not have COVID. So again, just a reminder, COVID is a huge burden on the hospitals, but all of the other work does not stop. I'll remind you, so that 474 number, we've set as a threshold here 600 for our ICU capacity here in Chicago, where I start to get a little worried when we see that rising above 500. We were just above 500 yesterday, so we keep an eye on how that's going up and down. Really want to make sure we stay under 600, because when we have, the 699 non-COVID patients plus our 474 with COVID, it's almost 1,200 patients.
Yes.
And during normal times, we don't even have 1,000 ICU beds. So these are all surged ICU beds already. This is part of why the hospitals are so full. And with their surge, they've got about 1,400 or so beds right now that they're able to use for ICU. But it is by far the area that we're the tightest on, if you know what I mean, in our Chicago hospitals, because unfortunately, a lot of people who need admission to the hospital end up needing ICU care, get really sick, more than we see for a lot of other viral diseases. So that's the one we watch the most closely. Just for comparison, we have 1,188 people in non-ICU beds who are COVID patients or patients under investigation. And then in comparison, we have 4,749 people without COVID. So, many more people in the hospital without COVID than with it. So the 1,188 is fine. We've set a 1,600 bed threshold for kind of our hospital capacity concern across the system. So doing okay there. And then similarly, from a ventilator standpoint, there are 325 people right now with COVID, either patients or people under investigation that we're waiting for test results.
On ventilators?
On ventilators. So that's 325 people really critically ill. But in comparison, there are 431 people on ventilators without COVID. So again, just reflecting, the multiple roles that our
the hospital continues to do its
hospital
normal
continues
work.
to do its normal work. Absolutely, we have plenty of ventilators available. That is not going to be we managed to build up. We got some additional ventilators, got them in. So that is not going to be the primary concern. But people who are on ventilators have to be in intensive care units by definition. And so it's really that ICU capacity that we worry about the most. And so where we talk about, potentials for second surges or things building, we saw what happened, in Italy, but then really in New York too. There's really, really excessive deaths related to COVID, in part because there just was not capacity. And so a big part of what we're looking to avoid is just following the hospital capacity. So you can go on the Illinois site if you want to see what's happening around the state. I will tell you that our region and the region right by us are the two that are the most stretched by far. There are many days here where Cook County is having more new cases than really anywhere else in the country still.
Yeah.
And so it remains a very active situation, and
And we have to keep an eye on it.
we have to keep an eye on it. And we CDPH, helps sort of coordinate the hospitals. Each of them are doing amazing work and working to sort of fit COVID into everything else. But we look at some of this capacity across the system and look at things like how transfers are happening, just wanting to make sure that there's sort of good system-wide awareness and that people are getting the level of care that they need.
Okay. At Alex Nitkin from Twitter, we all know that you're supposed to wash your hands for 20 seconds.
Yes.
It's like one of the most important things that you can do, right?
Yeah.
But how much of that time should be spent lathering and rinsing?
I love it. Okay, so if you are interested in this, the CDC actually has a lot of information on its website about hand washing, because it actually is one of the most important things that you can do, that people in healthcare facilities can do. Forget COVID. During normal times, when the health department is in doing some sort of outbreak investigation or some sort of infection control work in a long-term care setting or in a hospital, one of the things that we actually do, there's this secret shopper kind of idea where you stand and you watch the healthcare workers sort of coming in and out of the room, and like, are they appropriately cleaning their hands, before and after touching patients. And it is actually it's the thing that gets drilled into you the most in those sorts of settings. Yes. But we still we never see 100% adherence. And so I think that very high, and so I have like apps on my phone that are for like hand hygiene tracking. It's just something, it sounds so basic, but it's one of the most important things, critical, but hard for people to sometimes remember to do. So there's all sorts of, in healthcare settings, there's things that you can do about the way sinks are placed and where hand washing and alcohol hand gel is placed. The location, sort of what can you do, kind of in your... Right, what can you do to make it very, very easy for healthcare workers to do this most essential thing, and trying to sort of empower patients and everybody about even if you're at the doctor's office, if you see somebody not wash their hands before they come up, like, you absolutely should let them know. And when you're in medical school, you have to take these tests with actors who are pretending to be patients, and there are people grading you, and that you have to sort of show that you know how to do the parts of the physical right, and you have to talk through what you would be learning. And so it's this famous thing that you might know everything about the heart exam and be able to explain in huge detail and know all, the whole textbook, like front to back. But if you do not wash your hands, you fail. You fail the whole thing. So they really drive it into you. But anyway, so this thing for the 20 seconds is actually somewhat based on data. Like there's been studies of this, just like that there has everything else. And really the recommendation, you want to get your hands wet, and then you put the soap on, and then that really, the 20 seconds is meant to be, all of that is supposed to be kind of lathering time. So it's not like, 5 seconds getting your hands wet and 5 seconds of lathering and 5 seconds of drying. Like, it's actually supposed to be, get them wet, get the soap on, and then you want to get like your hands, your wrists, between your fingers, the backs of your hands, ideally kind of under your nails. And you spend that whole 20 seconds sort of doing that lathering and scrubbing, and that, one of the ones they teach you can choose whatever song you like, but the humming happy birthday to yourself twice is about 20 seconds. And then, rinse it off. And then ideally you're using a paper towel to turn off the sink. The more important thing is that you're drying with a clean towel or just air drying. And, we talked, I think, was it 2 days ago? Someone had this question about wipes and how long
it was 2 days
we should use wipes. So as long as we're talking about hand washing, so alcohol hand gel, which people use a lot, that also has instructions on it. If you look at your alcohol hand gel, it will tell you actually how much you're supposed to use. And so if it's a dispenser on a wall, like 1 pump will be the amount that you're supposed to use. But if it's a little bottle, it'll actually, it's got some directions on there. And the whole point is kind of like how we said you have to get your surface wet, you have to get your hands all
of it
wet.
wet.
And actually, the amount of time it should take for that to dry is also about 20 seconds. And it's the same idea that you actually have to have the alcohol, which is what's killing the germs, sort of present for a certain amount of time, and it also is about 20 seconds. So you don't save time with doing this. I know people have to find the sink and everything else, but if you just use like a tiny bit of hand sanitizer and try to make it last, you're not getting it on all the surfaces. You're not getting your hands wet enough to then be wet for about that 20 seconds it takes to dry. So, and if you are more interested in that, I promise the CDC has like pages and pages about hand washing and studies and everything else. But it's a good, it's a
good reminder to read our labels. Huh?
Read your labels. Your cleaning labels will have a lot of information on them if you take the time to read them. And there isn't anything better about hand sanitizer than about hand washing. And actually, if your hands are visibly dirty, it's better to wash them with soap and water than it is to use a hand sanitizer.
And that's what this question from Catherine Bramlett was all about. How much
people
more
are reading my mind. What's the question?
How much more is antibacterial soap effective over regular soap? We are about out of liquid hand soap, and I can't find any antibacterial hand soap.
Yeah, good question. So you don't need the antibacterial hand soap. So this has actually been, it's a hot topic pre-COVID because there's some thought that the major increase that we've seen with the antibacterial products have led to more bacterial resistance. And so you don't really, like outside of a hospital type setting, you don't really need to be using the antibacterial products. The soap and water are doing just as good a job in terms of actually, they sort of emulsify it, they lift the dirt, they lift the germs, the water rinses them off. It's more of a kind of a friction type thing than needing an extra antibacterial. And I'll remind you, remember, if you're particularly worried about COVID, COVID is a virus, and so not a bacteria. So antibacterial has nothing to do with sort of COVID. It's more this process of removing. And so regular soap and water, 100% good. You don't need to be using the antibacterial more specifically. Time, good job of lathering your hands is more important.
Yeah, and often.
And often, yes.
Okay, great. Danny Morales from Facebook. Regarding masks in public, should a runner be outside running with a face mask? Some people say yes, and I don't, which is right. Just would like some clarification.
Yeah, so we haven't mandated that you have to have a mask on if you're out and if you're exercising. What the order says, the governor's extension of the stay-at-home order is that if you're in a setting where you can't maintain a 6-foot distance, right? And so particularly inside, stores, et cetera, you need to be wearing them. But for people who are outside, if you're running and you're by yourself in particular, like do a courtesy of trying to keep that distance from people, right? And if you're running in an area where you shouldn't be running in an area where you think there might be a lot of people, run away from that area. There's not a requirement. I know it can be hard for people if they're just in terms of trying to do the running and everything else. So it's not a requirement. But if you can't keep that 6-foot distance, then you need to wear one.
So run someplace where you're not going to be
run someplace where you can't run at a time that you're not going to be running into people. Again, the risk of sort of running past very quickly is low. It's not a major concern. And so I don't personally, if I see somebody out, running without a mask, I'm not like, oh my goodness, I can't believe that person's out without a mask. I get much less happy when I see things like I was seeing last night of groups of people sort of sitting together where it's possible they're all in one household, but it doesn't really necessarily look like they are when you're talking to them. So, that would be my thing. I think if you can wear a mask, it's just a good visual sign that like I'm looking out for others. But if it limits your ability to exercise, keep away from other people.
Got it. Okay, Kathy Sunley Lawler from Facebook. Why are the deaths on the Cook County Medical Examiner's page most in COVID? So I think asking about why there's a high number of deaths connected to COVID on the Cook County Medical Examiner's page.
Okay, so I would ask sort of which part of the Cook County Medical Examiner page you looked at, maybe. So, we of course work regularly with the Cook County Medical Examiner all the time, not just around COVID. And they actually have different kind of maps and data streams and websites for many of the different things that people die from in Chicago. So it is true that they have a COVID-specific now kind of page or dashboard about that, because of course there's a lot of interest in that right now. But they also have right now, they have one focused on homicides, they have one focused on opioid deaths, they have one focused on extreme weather deaths, so cold or heat, those are things that we track. And they have data for just all the deaths broadly.
Yes.
And
Cumulative.
so, cumulative, yeah. And we get a lot of questions. I think people are sometimes a little confused just about the medical examiner in general. So when someone is diagnosed with a disease or an illness, there are a lot of protections around their privacy. So the health department can almost never release sort of the name or the details of someone who has been diagnosed with an illness as long as they're alive. In all of our contact tracing, we have ways to protect people's privacy while we do the investigation that's needed. There would be very, very rare instances where we would share that, and it certainly would not be in a public kind of way. As people probably know, there are privacy protections at baseline, then even more for health information. So people talk a lot about HIPAA. HIPAA is related actually more to kind of insurance in your use of data, but you've all signed those forms, and there's just a lot of protection. However, once somebody dies, actually, HIPAA doesn't apply, a lot of these other privacy, they just don't apply anymore. And so on the medical examiner website, and then eventually sort of as the investigations are completed, a lot of information is available about people. So names and ages and where they're from and the details. Your death record actually is a public document. And so we sometimes get a lot of why can they talk about it and you can't talk about it? But that actually is there are privacy things that just don't extend to after you die. And so we at the health department get a daily record basically from the medical examiner. And so and those are they'll be like preliminary findings, for example, and then sometimes those will get updated as additional things come in. The medical examiner has the ultimate say, as we've talked about, for cause of death. And
they list contributing factors
And they list contributing factors. Yeah, so actually that's a good point. The COVID part on the website, it's actually COVID associated, and so if you look in the footnotes, it specifically says whether it's a primary cause of death or a secondary contributing, et cetera, they're capturing anything that has COVID in it. And so just like the health department does, the medical examiner's office has worked pretty hard, I think, to make sure that this data is available. You can download it, you can map it. There will always be some discrepancies because everybody's updating it every day and things move back and forth. But by and large, we really, we're in sync, and we will alter sort of public health data if the medical examiner makes different findings, et cetera. And then all of this eventually ends up in death certificates. But death certificates often won't be finalized for sometimes months. And so at the end of the day, that's why the final kind of mortality numbers, they'll lag sometimes by months. And so where we put out the CDC or the state or the Chicago Department of Public Health, we'll put out, annual numbers for how many people died of X, Y, or Z. Often, sometimes even a year later by the time those have all worked through. So there's different levels of kind of initial reporting because we wouldn't want to wait a year to know who had died there. But there will continue to be some sort of slight variations in that as investigations happen and data gets exchanged. But yeah, so a lot of people have died from COVID, but a lot of people have died from all of the other things that people continue to die from in Chicago as well.
Yeah, okay. So check out that website.
Yeah.
Rebecca Van Deventer from Facebook. What kind of measures are being taken to change the procedures on the CTA to make it safe for people who need to take the bus or train for work?
Yeah, absolutely.
And an important question as we look ahead to some
Yeah.
people maybe returning to work later in the summer.
That's right. So there are Chicago Department of Public Health employees who take the CTA to work every day, as there are other essential workers. And we've certainly been in touch with CTA very frequently through all of this, as they've been working to really make sure that their practices are in line with CDC guidance, CDPH guidance, and really doing everything that they're able to do to make this really, as safe as they can. And so their website also, I know, has a lot of detail on there, including like the pictures of the different kinds of cleanings they're doing and some things about protocols. But they're doing, they've really stepped up cleaning protocols on the trains and on the buses, both sort of the frequent cleaning as well as the deep cleaning. They're going, I know, all the way up to the top of the windows, for example, very frequently in the trains. Have thought a lot about things like ventilation. I mean, really on the trains, those doors open a lot, and there's there actually is quite a lot of flow that comes through there. On the buses, as you know, move to some rear boarding, thinking about how many people can be on the bus at once, wanting to be keeping distance. There's things like, keeping a seat in between seats on the train, keeping a row in between people on the bus. Again,
trying. There's already some signage that's
there's signage
prompting riders, and I imagine some of that might get ramped up a little bit as we're moving into.
It's going to keep ramping up. I'm sure we'll have more hand cleaning, hand sanitizing platforms. Certainly recommend wearing that face covering in that setting. Yes. They're using the partitions for the drivers on the buses. As you know, the train conductors are sort of in their own section. So I would just say that be aware when you're on the CTA, and I'll remind you that if there were virus and you touch it with your hands, only if you then touch your nose, mouth, or potentially eyes without washing your hands will you actually get sick from that, right?
Yes.
And so the surfaces, as long as you're aware, are not really that major a problem. If you've got hand sanitizer with you, great. Otherwise, make sure you wash your hands, after you get off before you're touching your nose, mouth, or face, and then keep that 6-foot distance. If the train is crowded, if the bus is crowded, not so much a problem right at the moment, but wait for the next one. And, there's some interesting conversations that are happening as we think about large numbers of people coming back, and transit has been one of the most important areas of conversation.
Definitely.
So I'm not going to kind of jump ahead too much to talk yet about what that looks like, but there's things like thinking, staggering, the potential of sort of staggering work hours, trying to avoid that rush hour crush, which we all remember. Other systemic things that we can do. But the CTA has really been on this in terms of being really, I think, as mindful as they can be about putting these structural things in place.
Yep. And there's a lot of conversation with industry, right? Because they're expecting workers to come back, so they can do things like stagger schedules and have some people who remain working at home if they can.
Yeah, and that's why there have been, in some of these federal there's another big federal discussion today about the next round of potential funding, and transit has been called out specifically because you recognize if you're going to have your occupancy down that much, what that means sort of financially to be able to run. But it's essential for people, especially here in Chicago. A lot of people don't have cars, need to be able to get around. Not always feasible to take a bike or walk, and big part of the conversation.
And a lot of people who cannot telework.
Yes, exactly.
Have to go to work. Yeah. Okay. We are getting down to our last couple minutes. Okay. I will ask one last question, and I'm always trying to find the last question that's going to be like a short answer.
Yeah.
I think Nola's helping us out with this one. At Nola M on Twitter. Am I supposed to wear my mask while driving alone?
No. If you are driving alone, by definition, you are at least 6 feet from other people, and in fact, you're not only 6 feet from other people, you have a whole, your own little enclosed car, just like the train operators do. So you do not need to wear a mask while you're out driving.
Okay. All right. Well,
good.
Let's get to some good tips, some good news,
tips.
Good stuff.
All right.
What you got?
I got a couple things. So one is I wanted to just note that today the mayor has actually proclaimed, and typically May 15th is Trauma-Informed Awareness Day in Chicago. And certainly, May is Mental Health Awareness Month anyway, and I think COVID has brought mental health issues, which are always there, even more to the
forefront.
forefront here. And I think, you know, CDPH has a long history of working on mental health issues, thinking about what can we do. You know, we do some direct services, but also sort of at a community level, what does it mean to sort of think about promoting mental health? And we've been doing a lot of work. We'll be making some, you know, announcements soon, I think, about some exciting new things that are coming. But we really recognize how difficult
Yes.
this has been. And I don't know how much people know about trauma-informed practices generally, but not to sort of get too off track, but there's something called ACEs, and if people have never heard of this, I encourage you to look it up. ACE stands for Adverse Childhood Experience, and there's been a lot of work that has some surveys that have been done that have recognized that when children in particular are exposed to these adverse experiences, and it's everything from sort of physical or emotional or sexual abuse to more common things like separation or divorce, or having a family member who's incarcerated, or substance use in the household,
Yes.
domestic violence, things like that, these adverse childhood experiences actually over time are very predictive of adult negative outcomes. So
including health outcomes.
lots of health outcomes. So, you know, everything from sort of substance use and depression and mental health, but also things like diseases, obesity, heart disease, cancer, life expectancy actually sort of goes along with this. And so we think a lot about when children have these adverse childhood events, what can you do to sort of support kids at that time to help prevent them, but also to help them be resilient and not have kind of the trauma that can associate this come along with it. And so there's this whole like really interesting body of work. I won't get into all of it now, but and the health department's been interested for a long time. So people who have like 6 of these adverse childhood events, they live 20 years less long, right, than people who have more. And so trauma-informed services or work kind of recognizes that all people have some history of some traumas in their life, and adverse childhood experiences being some of the prime ones. And there are ways that you can actually deliver services and engage with people and support them that kind of recognizes that a little bit and does not accidentally re-traumatize people or lead them to not seek care or to not get help. And so, you know, not just at the health department, but the transit agency and the housing authority and the park district and the police department and the libraries and the public schools, lots of work with thinking about how to have these more trauma-informed type practices. And with COVID, it really makes me think because, you know, we've often associated, you know, something like a big hurricane, something, you know, one of these big traumatic disasters can be pretty traumatic potentially, right? For young kids if their families, you know, especially have a lot of adverse events from them. And, you know, there is some concern that where families are being especially negatively impacted by COVID, you know, how are children reacting to this, and trying to think about building some of that resilience and not having it turn into the trauma that can go on to really impact your life long term. So there's a lot of interesting work happening around this, but just wanted to highlight that today is Trauma-Informed Awareness Day, so I encourage you to just go read a little bit about that online. There's things on the Chicago Department of Public Health website and others, and you know, maybe we'll bring someone on down the line to talk about it.
Yeah, and I think just wanted to note that the experiences range from families that are suffering from unemployment or food insecurity, but also the effects of isolation and anxiety about the disease and getting it and
right. And we think about, you know, times of stress tend to bring out more, unfortunately, with the domestic violence sometimes, and just, you know, it is just a time where everybody is on a shorter rope than they normally would be. And I think especially where that is combined with not a lot of resources available to meet that, it's something we've just been thinking a lot about and developing some programs. So more to come on that, I hope probably next week, related to some announcements. I'll also just say, in terms of things that you can do, there is now a Chicago Census texting team to help other Chicagoans get counted. You'll remember that we need to count all Chicagoans here. We really really, really
can't
do for the
emphasize it enough.
census.
Yeah.
This is how we get money for Chicago. Things like how much COVID money we get depends on how many people live in Chicago. And if we don't count people, we don't get the money.
It affects our representation.
It affects our representation
which affects
in
decisions
Congress,
that are made.
The whole thing. So we're still at less than half of the city being counted, is my understanding, and that is no good for anybody. So you can go to chai.gov/text and join the volunteer texting team. So there's this
great.
grassroots campaign getting word out about the 2020 census. You can sit on your couch and help reach people. So sign up and they'll give you some more info if it's something you care about. It's something I certainly care a lot about, but I don't have time to join the texting team. So please join it.
And we need everybody
really
who
do.
lives in Chicago.
Yep. Takes 10 minutes to fill it out. And then maybe the last thing we'll note is we have a nice picture that got sent in. This is Olivia. It was Olivia's 11th birthday. And Olivia happens to be the granddaughter of Loretta Miller, who is one of our fabulous regional communicable disease sort of supervising investigators. And this picture is great because it shows Olivia with a quarantine birthday sign. And so it basically says no one is invited. And it's just it's a cute picture. But, we heard from Loretta that, this was just the family gathering but they played games, and it was a very, she said sort of, not a lot of expense, not a lot of, compared to often where we're pulling in a lot of people, but that Olivia in particular thought it was a really fun birthday, and I love this sign. So happy birthday to Olivia and to that whole family, and really to all the kids who have been having to alter their birthday celebrations and think about other ways to kind of mark the passage of time at this moment. So I thought that was really cute. Thanks for sending it in.
Yeah, there's so many important rituals and traditions and transitions that our youth have had to adapt to.
Exactly.
Including our seniors who are graduating from high school.
Yep.
So I'm happy that we are going to be doing a virtual graduation for them.
Citywide.
But great to see our resilient youth
Exactly.
Adapting to the circumstances. Well, we'll be back tomorrow at 11 a.m. as usual. And until then, maybe the rain is helping you with this this thing that we need to do for the rest of the month. Stay home.
And save lives. We'll see you tomorrow.